and welcome to Face Off here on France 24. The World Health Organization has upped its alert level for the outbreak of swine flu, now spreading across the planet from 3 to 4. And around the world, countries are checking their stockpiles of antiviral drugs and preparing for the worst. Could we be on the verge of a global pandemic of the sort that killed over 1 million people in 1968, or the even more devastating outbreak of 1918 that killed 50 million? The WHO says it's no longer possible to contain the deadly virus, which is already thought to have claimed 152 lives in Mexico. But are we in danger of exaggerating the threat and of spreading unnecessary panic? And are we getting our priorities right? Do high-publicity alarms about potential pandemics deflect attention from more pressing issues of public health? Well, joining me now to debate the issues involved are Dr. MARC Girard, who's an epidemiologist, and Jean-Michel Bardet, who's a journalist who specializes on medical issues at Le Figaro newspaper. Thanks very much to you both for being on the program. Marc, perhaps if I could begin with you, just how dangerous is this epidemic at the moment? How worried should we really be? Are we in danger of perhaps getting things out of proportion here?
I think that for the time being, it's difficult to say how dangerous the situation may be. But we have a previous instance, which is that of avian flu. And now, after enormous alarm and media coverage, people said that over 6 years, we had about 250 deaths, which correspond to approximately 40 deaths per year. So try to compare, for example, to the number of deaths due to poor supply in water, which is 8 million each year.
With the difference that this new H1N1 virus, who is said to be swine flu, we'll speak about that later, I think, has the potential of being a pandemic virus because it spreads from human to human, which the avian flu does not. And also it's already...
The fear was that it would mutate into a form of the virus that would spread.
It's not a mutation, it's a reassortment of genes. The swine is the pig is a very efficient lab, you would say, to rearrange for many different genes from avian, swine, and human flu virus to combine. And this new virus has already probably gone around the world and has killed humans and has the potential to transmit itself from human to human, which the avian flu does not.
Do you accept Mark's argument, though, that 6 years after the start of the scare about SARS...
With the difference that perhaps the health authorities of our countries have, I think rightly, put together pandemic plans to prepare for this very instance. And we hear from scientists, I've been hearing for the last 30 years that there's going to be a new pandemic. Yeah. So what would the citizens of Europe and the world say to their government if they had not been preparing themselves for this very instance? So, it's a balance, it's an equilibrium.
But colossal resources get spent, don't they, on preparing for this sort of thing? And I suppose the question one might ask is, could they be better spent elsewhere? For instance, in the fight against malaria or in the fight against, AIDS, or in developing better water supply for people in parts of the world where it's in short supply.
It's not the same. I think it's not the same instances that spend the money, for instance, for malaria. There's a global fund now for malaria, and there's a number of private donators like the Bill and Melinda Gates Foundation that are being very efficient, much more efficient than the WHO has been with its rollback malaria program. So different actors do different things, and I think that the responsibility of our governments to prepare for such a threat is something that, yes, we have to spend money on it. We're spending, for instance, money on Tamiflu and Relenza, these antiviral drugs, and we know that the stock that we are piling are going to get obsolete if we're not using them. But that's part of a strategy, and for instance, it's the same with defense. You buy new weapons, and you know they're going to be obsolete, but you still buy them and make them.
Mark, do you think we're spending our resources correctly?
In fact, I think that the risk of pandemic was also an issue, a major issue with the avian flu. And the result now looks like a false alarm. So I think that this precedent of avian flu cast important doubts on the credibility of health agency, national or international.
You say that, but what do you think it should be doing?
Should be doing. I think that the real question is who may have any interest in spreading alarming news when it's true, when it's demonstrated now that the avian flu was a false alarm. And
to interrupt you, maybe the newspapers have an interest.
The avian flu, well, we're not making the news. The news come to us.
But
the avian flu has killed millions of birds over the world, and it has having a major economic burden on the economy of poor countries, for instance, and it still is not controlled in, for instance, in Indonesia and Philippines, where they have thousands of islands and thousands of birds.
Devastated poultry farming.
Yes,
isn't it?
and it's a paradox because, for instance, Vietnam